Hello, this is Dr. Ron Valdiserri. I'm the Director of the Office of HIV, AIDS, and Infectious Disease Policy in the Department of Health and Human Services. You know, as the temperatures begin to drop and the leaves start to change color, I think all of us naturally think about winter and the winter holidays. But I'd like each of you to think about something else, and that is World AIDS Day, which we commemorate on December 1st every year. World AIDS Day is a time for us to reflect on colleagues and friends and family members we've lost to the epidemic, and importantly, a time for us to recommit our efforts to address this global pandemic. Now, in the United States and globally, we're fortunate that over the course of 3 decades, we've made tremendous strides in the diagnosis and treatment of HIV infection. And for those of us who were around in the early days of the epidemic, we remember the despair and the fear that permeated the word AIDS, because really there was not much we could do except make people comfortable during the final stages of their infection. That's completely different now. Now, if we can diagnose individuals in a timely manner and get them in care and help them stay in care, they will lead a near normal lifespan. And that's great news. But unfortunately, I think too many Americans have interpreted that to mean that HIV infection and AIDS is no longer a problem in the United States. That is not true. I would like you to think on this World AIDS Day about the young high school student who may not really understand what risk of HIV means and may have some really important questions about what he or she can do to prevent acquiring the infection. I would like you to think about the young mother who's recently been diagnosed with HIV and is very concerned for her children and her family. And I would like you to think about the gay man who's heard about PrEP, or pre-exposure prophylaxis, but doesn't really know where to find those services in his community. In other words, I would like you to think not only about the tremendous progress we've made in combating the epidemic, but also about the ongoing unmet need that still exists in this country and elsewhere around the world. And while it's true that we may no longer have a crisis mentality when it comes to AIDS, that doesn't mean that AIDS is no longer a problem, that AIDS is insignificant, that AIDS has been taken care of. So on this World AIDS Day, I ask each of you to recommit to providing the best possible prevention and care services that we can provide in this country and elsewhere across the globe, and to talk about HIV and AIDS with your friends, with your family, with your children, with your coworkers. And let's really use the opportunity of World AIDS Day to recommit to a vision of a world free of HIV infection. Thank you so much for your time and your attention.